Hello and welcome to another Top Doctors Online interview where we speak to one of our leading specialists. Today, we're very privileged to be joined by revered specialist orthodontist, Dr. Cho Soo Chi, whose practice deals exclusively with orthodontic brace treatments, to discuss the options available for adults looking to improve the appearance of their smile. Welcome, Dr. Chi, and thank you so much for joining us today. Would you like to introduce yourself and tell us a little bit about your background and your areas of expertise?
Absolutely. Thank you so much, Sophie. Thank you really very much for inviting me today. I'm a specialist orthodontist and I've been qualified for over 15 years now and have been in private practice for the same length of time. So I founded two brand new startup specialist practices. So I've got my offices on Harley Street and in West London on Hammersmith Grove, which has now been open for over 12 years. So I'm really delighted that you've asked me to come on today.
Thank you very much. We're delighted to have you. So, as I mentioned, we're here today to talk about a topic that may well resonate with many people who are listening at home, and that is feeling a little bit embarrassed about your smile. So, although some people do undergo treatment to straighten their teeth in their teenage years, many people do reach adulthood and don't really feel that confident about the appearance of their teeth or their smile. So to
Yeah.
start off with, Dr. Chi, could you tell us what are the most common reasons that adult patients come to you and what exactly is meant by orthodontics?
Yeah, absolutely. So I guess one of the things nowadays is that we live in a far more health conscious society, health conscious world these days. You know, people are living longer, healthier, and they take pride in their appearance, you know, however old they may be. So I would say probably 90% of our patients, you know, they're looking to improve their smile. So the majority of patients, you know, they are happy, they're confident, you know, they're not, you know, completely embarrassed to show off their smile or anything, but they're looking to achieve an improvement, something, you know, can it be improved a little bit better? I mean, say for example, my oldest patient that came to be treated. I mean, she was 72 when she came to see us, and she, you know, she was very healthy, confident, energetic lady, and she had always this bugbear about her lower front teeth. Um, and it's always been in the back of her mind. And she came to see me and she was like, well, you know, I am in my 70s. You know, is it worth it? Why am I doing this? But you know, she was wondering why should I be doing it at my age. But my answers to her were like, you know, her teeth and her gums, they were as healthy as any 30-year-old that I may see. And also, why not? You know, why should age preclude you from achieving what you want? And we did, you know, 14 months of orthodontic treatment, and she's got the perfect lower straight teeth that she's always desired for the last, you know, 60 odd years. So a lot of patients come in for those, either those minor tweaks or you know, just to get as good as they can get. And also, I guess in you know, in the world that we live in now as well with social media, we're constantly taking selfies. We are looking at ourselves, and you know, particularly the last, you know, 2 years, you know, with everything that's happened, we see each other ourselves on Zoom quite a lot. So and again, we start to see bits that we want to look at and to improve, and that's another reason why, you know, patients come to achieve you know, a better smile or a straighter smile. Also, there are a fair number of adult patients who, for whatever reason, in their childhood, you know, didn't receive as adequate an orthodontic treatment as they would have done now. I mean, orthodontics 25 years ago was very, very different from what it is now. Extractions, for example, were probably a lot more commonplace because now, with different techniques, seeing patients and treating patients younger and nipping things in the bud, you know, we may not have been in extracting teeth in these certain cases, which had been in the past. Also, patients, you know, have had teeth extracted, teeth have relapsed. Say, for example, maybe 20, 25, 30 years ago, fixed braces themselves were generally, you know, rarely fitted, to be honest. You'd have a removal brace, like a little plate that you take in and out. And as you can imagine, you know, 12, 13-year-old child, you know, not wearing it, things don't move. and then 30 years later, the teeth have moved back. So we have probably half our adult patients had some kind of treatment within their childhood or the teenage years, and things have just moved back. And even, to be honest, 10 years ago, so we have a good number of patients who are in the 20s. They had fixed braces, but unfortunately, the importance of wearing retainers was not emphasized enough. So they had the treatment, they wore the braces for 18, 24 months, but unfortunately didn't wear the retainers after that. So again, there's been relapse, teeth have moved, and they want to get back to that perfect smile that they had, when they were 13. So we have a number of different, reasons why adults are seeking treatment, from, just improving and tweaking some little bits, to relapse and the more severe complex cases.
Thank you so much, Dr. Chi. So going back to something you've mentioned there a little bit, many people may have different kinds of memories about braces from years gone by being very large or very painful. How have orthodontic treatments developed and improved in recent years?
So I would definitely say, it's no longer, having a mouthful of big metal braces, for sure. I mean, even now, I guess the metal braces that we use are actually quite small. The brackets themselves are quite small. I mean, when I was growing up, I mean, very, very, very few kids at our school had fixed braces, let alone adults. But now it's completely different. Like, the innovations in braces, and along with a massive change in attitude as well, in people's attitude for themselves, being less self-conscious to do something for themselves. It's a lot easier for adults to have orthodontics. So in terms of innovation, I mean, what we're talking about is definitely the more discreet brace. So the ultimate, I guess, invisible brace that we have on, or that I use, is a lingual brace. And what is a lingual brace? Well, it's a brace it's a fixed brace, so like a normal fixed brace, but rather than being on the outside of the teeth where people can see, it's on the back of your teeth. So when you smile, when you talk, no one knows that you're having braces unless you physically show them or tell them. The brace that I personally use is lingual. It's a lingual incognito brace. That's the name of the type of brace. And the reason that I use the incognito brace rather than other types of lingual braces is the two things that are really important with a lingual brace. So one, it really has to be patient comfort. You've got something on the back of your teeth, a larger brace, so it has to feel comfortable for the patient, on the tongue, on the lips, so it's as comfortable as it can be to wear. And secondly, it has to be accurate. So the results that I want to achieve at the end of treatment, it has to be able to perform to that. So that's why I personally use the incognito brace. And lots of people wear the lingual braces. I mean, I'm sure you've probably heard, like, for example, Kate Middleton, before she married Prince William, she had a lingual brace to perfect her smile. But obviously, a lingual brace is not for everyone. It's not everyone's cup of tea. And a normal conventional brace, on the outside, there are clear brackets or ceramic braces. And over 10 years ago, I mean, Tom Cruise, he's got $1 million smile. He had fixed ceramic braces, so it's good enough for him. But that is that is discreet, but it's obviously still fixed onto the teeth. But I guess the biggest innovation, I guess you could say, is Invisalign. I mean, Invisalign has transformed the landscape of orthodontics. The huge advantage of Invisalign, obviously, one is that you can take it out. So you can take it out so that there are no issues in your diet. There's no restrictions in what you can eat, what you can drink, and you can brush your teeth as normal. So lots of people like that. It's more, I guess, from a lifestyle point of view. As we get older, if we enjoy our food and like to go out, and want to have that ability to be able to take something out and look after your teeth as normal. And in terms of pain or tenderness, with Invisalign, generally, it's a lot less painful than a fixed brace, because the type of movements are very different. and it's easy sort of, day-to-day wearing. So that's probably been one of the biggest changes in terms of sort of treatment, and patients coming for treatment, or adults coming for treatment. And also, I mean, innovations in terms of, we at our practice, we're a fully digital practice. So what that means is, like, I don't know if you remember when you were younger, you might have had like GUI impressions, or like the horrible sort of sensations. So we don't do any of that. Everything is done by a 3D scanner. So everything is done accurately. Scans are stored. So it just makes the whole patient journey a lot more comfortable. There's definitely made life a lot easier for adults to have orthodontics. And I know you asked me just previously, I mean, I remember what is orthodontics? And I guess if we're being absolutely sort of breaking it down into what it is, I mean, the actual definition. So the word ortho comes from the Greek word orthos, which means straight, and dontics means teeth. So literally it is straight teeth. But orthodontics, it's more than just straight teeth. I think you have to remember that your teeth and your jaws, they support your profile, your lips. You've got the function of eating, chewing, talking. So when I carry out orthodontic treatment, we're planning the end results before we start treatment. So I'm assessing, I'm looking at the end positions and the results of your teeth, and taking into account exactly where your teeth and where your smile will be in relation to your lips, your profile, and more importantly, like long-term stability, because you only want to have the treatment once and you want it to last lifelong. So, we have patients, many adult patients that come in and they just want to show more teeth. They want a big, wide smile. But what we have to take into account, it has to be in balance with your lip support. If you just expand and widen everything, all you end up doing is pushing the teeth forwards. And aesthetically, that's not very pleasing. And also, it's very unstable. So we need to sort of, look to make sure that the end result is in harmony with, with your profile and with your lip support. And also assessing the physical shape of the teeth. So you can have, perfectly straight teeth in a stable bite, but appearance-wise, it's just not 100%. And the reason for that is, like, the shape of the tooth or the size of the tooth, it might be a little bit small or a little bit large. So, something isn't fitting quite well. So again, when I'm assessing patients before we start treatment, it's looking at the end result. I mean, I have patients who have, very small, front teeth. And if you close everything together, close all the gaps and bring all the teeth together, yes, the teeth will be straight, but it just won't look nice. So we're planning, with the end result in mind, so that the teeth are moved into the right position. They may need have some bonding done, but what we're looking for is to achieve the best aesthetic results with the teeth that they have, and with the whole balance and the profile, and lips being in harmony with each other.
Thank you, Dr. Chi. So you've detailed a lot of different options that are available now with modern orthodontics. Yeah. What are the ways that you determine which is the right treatment for the right patient?
So when patients come to see us, I mean, one of the main reasons why they choose to see a specialist is, for myself, I can give every single patient a completely independent treatment plan. So it's based on the patient's concerns, what they desire, what they aim to achieve, the dental issues, and also the results achievable. So in terms of experience, I've been doing this for the last 15 years, and sort of trained in all the brace options. So be it Invisalign, Damon braces, lingual braces, ceramic, normal braces. We can give the whole range of braces. So patients often come, asking for Invisalign. That is probably the most popular brace. That's the one everyone has heard of, and that's why they come in. But what we need to discuss with every single patient is the pros and cons of each type of brace, and also if it's suitable for them. So with Invisalign, I mean, they'll have heard of Invisalign, but the actual crux of treatment in terms of patient compliance is that you have to wear it. So, you're looking at having a brace that, yes, you can take it in and out for sure, and you can, remove it for eating and drinking and everything else, but you're aiming to achieve, between 20 to 22 hours of wear every single day for Invisalign to work. If you don't wear it, it just isn't going to work. So, we have some patients who know from the outset that they're constantly having coffee or they're snacking, and they just know that this is not going to suit their lifestyle. So that's really, really important to it's not just assessing the teeth, but assessing on a day-to-day basis what's going to work and what they will feel comfortable wearing. We have, we still have patients, who are still quite determined to wear Invisalign, but because with the cases that I do fairly complex cases. Sometimes I will put on like a few, I'll put on like a fixed brace on some of the teeth in conjunction with Invisalign. So why do I do that? The reason I do that is it makes the treatment more efficient, often more effective. So they're wearing the Invisalign for less time, but making sure that the results are the best that we can achieve. So assessing patients so that we can provide that treatment plan. And obviously, if that doesn't suit, then we have the fixed braces as an option, and whether it's the invisible braces on the back of the teeth or whether it's braces on the front, we can discuss all options that are suitable for their particular issues, their particular dental issues.
Thank you, Dr. Chi. So if we're thinking about long-term commitment here, how long is a typical adult orthodontic treatment, and what should patient expect in terms of committing to the treatment and the results going forward?
So it's a case by case. Fairly, if for example it's a fairly complex case and we need to extract teeth, generally you're probably looking at wearing braces from 2 to 2.5 years, depending on the type of brace. For the less complex cases, on a general figure, it's around 12 months, 15 months in terms of wearing braces. So as I said, the most important thing when patients come to see us, is, as I said, is to know what the patient's aims are, what the desires are, and how we can help to achieve that result. So, I think as we chatted before, a lot of adult patients that come to us, that they have had some kind of treatment, be it in their childhood or even more recently. So it's not necessarily a blank canvas that we're working with. So for example, they may have had teeth out when they were younger, but things have relapsed and they've still got a bit of an overbite, like the front teeth are still sitting, a fair way ahead of the lower teeth. Now, in adulthood, it is harder to treat overbite, but if you've already had extractions, you don't want to take any more teeth out. So there is a sort of compromise in certain elements, but the main thing is showing the patient what can be achieved and the results that can be achieved, even be a compromised result, so that before we start treatment, we know exactly where we're going to end up to make sure that's where we want to be. So in a way, a lot of the cases, we think out of the box. So that's why I love what I do, and every case is so different. It's seeing what the concerns are and how we can get to that end result, and to work together. And obviously, as mentioned before, like age itself is definitely not a limiting factor. I mean, yes, my oldest patient is 72, but I have many patients in the 60s and the 50s. So age is not at all a factor. It's making sure that the foundations are healthy, healthy teeth, healthy gums. That's what we need as a start off. And from that, everything else we can do.
Thank you very much, Dr. Chi. So just briefly to finish off, what is your advice for anybody listening at home who would like to improve the appearance of their teeth?
So I would always say to everyone, you only have one set of teeth. Please seek specialist advice, like you see an orthodontist. say as an analogy, if the electrics went off in your house, it's unlikely you would use YouTube to start rewiring your house. And in the same way, it's your health. Why would you treat yourself through the internet? There are many companies out there. You've got Smart Direct, for example. So I think people forget that. People just think, oh, it's just going to straighten teeth. It's going to move this tooth. That's great. But your teeth, your roots, your gums, everything is interconnected, and you don't want to run the risk of potentially, having bone problems, gum problems, or any issues with your tooth. You only have one set, so make sure that you have a consultation. You see a specialist orthodontist. We've trained for over 10 years. I mean, you do 5 years at dental school, then you do further postgraduate training, so that we can assess accurately to provide the results that are stable and will last. So really, really important. Always seek the advice of a specialist.
Thank you so much, Dr. Chi, for sharing your very specialist advice and expertise. I'm sure it's been really helpful for anyone listening at home who isn't quite happy with their smile. So I would just like to remind anybody who is considering orthodontic treatment that they can schedule a consultation with Dr. Chi to discuss their options by visiting our website. You can find us at www.topdoctors.co.uk. Delighted to have spoken to you today, Dr. Chi. Thank you so much.
Thank you. Thank you so much for having me. Thank you very much.